Hey, what's up, everyone? It's Dr. Glenn Vo. I am super excited for this edition of Nifty Thrifty Dentist Podcast because I have an awesome dentist with an awesome story. Before we get into this next episode, I'd like to give a shout out to one of our sponsors, MVP Mailhouse. Now, mailers have been around for a long time, but not any company can do direct mail for dental practices the way MVP Mailhouse does it. Check them out. Make sure you ask for a Nifty Thrifty deal. I've been using them for years, and you won't be disappointed. I mean, he's known on social media as Dr. Rad, but to me, he's just plain Dar, Dr. Dar. So, Dr. Dar Radfar and Dr. What's going on, man? Welcome to the podcast.
Hey, Glenn, how are you, buddy? Thanks for having me. I'm super excited to share my story to your audience regarding how they can possibly grow their practice with respect to sleep and treating sleep apnea and snoring.
Yeah, well, there's a significant story, and I always like to tell people that a business or a project anchored to a purpose is a strong one, right? And you have a definite purpose. But before we get into that, for those who don't know you, for those who don't know who Dr. Rad, right? I love it. Dr. Rad is all about. Just talk to me about, when you graduated dental school and, about your practices and where you're located. Let's hit up all the general info for those who don't know who you are.
So yeah, I've been practicing for 21 years. I went to USC School of Dentistry, class of 2002. And I'm a general dentist, but I treat about 25 to 30% of my practice is treating sleep apnea and snoring with a custom mouthpiece. Since then, I've launched my own brand and my own line called RAD Health. The kids at the office call me Dr. Rad because they can't say Dr. Radfar. And so that kind of propelled into RAD Health Incorporated.
Yeah.
RAD Health opened up about 2 years ago. I have a bunch of products. So I'm really into the entrepreneur world, but I do also see, 25 to 30 patients a day. I place implants. I do traditional ortho, Invisalign. I'm like you all. I do everything and anything is on the menu that I feel comfortable and I've been trained to do so. Now I'm trying to just take my expertise to the masses, teach dentists on how to do sleep, incorporate that into their office and also through my products.
Well, and again, just the fact that you're focused on sleep, you're very passionate about it. There's a story behind it, right? There's always a story. But I want to take you back, like way back, past going to dental school, past all that stuff. I love your story because, again, what I love so much about this country, and you and I have talked about this privately, is that we're really lucky. Guys like you and me, we're really lucky. We're blessed, right? And everyone else that's listening, everyone that we interact with, I mean, we're all lucky because there's no other country out there that you can come literally with nothing. Literally with nothing. If you're willing to work hard, to be determined, you can make something of yourself. And I want to take you, I want to take you way back. I want to talk about like you're just, you coming over here from another country, the circumstances behind it. That's another thing too, the circumstances behind it, and really just what you guys had to do when you first came over here to create a life for yourself. So let's go back in time and share that story. Tell us about your family, where you're from originally, and why you guys decided to leave and immigrate over to the United States.
Yeah, so, sometimes we take a childhood experience for the listeners out there. We have what we call childhood trauma, and sometimes we play a little bit of a victim mode. A lot of times, if we can push through that, we can see the beauty of something that's happened to us in our childhood. And for me, when I was 6 years old, I was in the country of Iran, where I was born. And at that time, religious persecution and the treatment of women was beginning to be more on the negative side. And so my mother had her hair covering in the streets of Iran when I was holding her hand, and her hair was kind of coming out of her hair covering, and she had a couple police, they're called morale police, come up to her, grab her by the neck while I'm holding her hand, not knowing how to protect my own mother, and saying, cover your hair or you'll get a beating. It was at that moment that when my mom and I went back to the house and spoke to my father, seeing what's going on, made courageous decision to escape from the country of Iran and come to America. We did that through horseback in 1983, through the mountains of Iran into Turkey. And on the escape through the treacherous mountains, I was told one thing that was very important that resonates was don't fall asleep on the horse, because I was holding on to a gentleman that was helping us escape. They were called coyotes that help you, navigate through the mountains.
Yeah.
Don't fall asleep. Don't fall asleep. So sleep was resonating in my ear about not falling asleep at the age of 6. And then came to this country, and then we can fast forward to why I do sleep,
Yeah.
which is in sleep apnea treatment, which in 2009, I actually did fall asleep. I fell asleep at the wheel going 40 miles per hour on an estimated, well, from what I've been told, and crashed my car into a tree. That incident, 7 years of into practicing dentistry, propelled me to understand that there's a reason why I fell asleep, and it was because I have sleep apnea myself. So I went through the process of getting a sleep test, a home sleep test, and then pursuing some sort of treatment that would help me. And the oral appliance was I was one of the first ones to make one, and it was one for myself back in 2010.
Yeah.
And that just exploded from there, with helping several thousand patients coming to my office to helping them with their sleep and their issues, so we can minimize the risk of them falling asleep at the wheel and all the other horrific medical complications that are associated with sleep.
I mean, literally, first of all, I will let everyone know I've heard that story before, but it's still impactful even when I heard it a second time, right? And when it comes to sleep, sleep has been almost like literally a life or death situation in your life since you left Iran, and also having this accident. It is something that is important to you, and you've seen what you've done, not only your own life, but the lives of all these patients. Do you ever look back and just look at the signs, like the stars kind of aligned, and honestly, I truly believe this, that sometimes there is someone that's just watching out for us, right? Like literally in 2 instances in your life, someone was literally watching out to you. Do you ever reflect on that and think about that?
Yeah, and it's crazy. There's signs out there, we call it synchronicities in life, that tell you to guide yourself towards being a bigger kind of help to society, let alone to yourself or your own family. And another story, as a third thing, a few months later after my accident, my 2.5-year-old son, I noticed he was snoring.
Oh, wow.
And so that was a red flag. And we went to a pediatric ENT, and he had his tonsils, adenoids removed, tubes put in his ears because he was getting sick frequently. So he had pediatric sleep apnea, and he went through, electively, we chose to do surgery on him, which was obviously very, very scary. Anyone who has children, choosing to do surgeries for them to be able to get better sleep is a challenge. And any kids who snores is not a good idea. They should be checked out by a pediatric ENT to see if there's any sort of surgical intervention. That itself propelled and changed his life. His growth percentile went from 30 to 90 in a matter of a year.
Wow.
He was much more happier in the morning. So
now, how old is this little guy now?
He's 15 now.
So he's a teenager now. He's a teenager now.
Yeah. So I've had some let's call it interesting pivotal points in my life where I said, okay, I got to see if I can put my efforts into helping people sleep better. And as dentists, we are a huge advocate for better sleep, because we can formulate a custom-made oral appliance that has been FDA approved since 2010 to treat sleep apnea and snoring in conjunction, or if patients that are not good candidates, or they can't basically tolerate the oxygen machine called the CPAP machine. So we are really industry leaders now to help people sleep. And that's my goal, is through my education, through my seminars and coaching program, and through my products, is just to help pay it forward so other people can sleep better and have less medical issues. And Glenn, we forget about the social aspect, right? I mean, sleeping next to a bed partner, going on a camping trip, sleeping next to, friends and whatnot. And it's very embarrassing to snore and to have that kind of problem.
Well, and I'll say this. for those who are listening right now and you're thinking, and they're maybe thinking like, well, I don't know if I can implement this in my practice. Well, this is what I would tell everybody. Do it for yourself first, man. Do it for you and your family first. Because I can tell you right now, the effectiveness of what Dr. Radfar implements his sleep with his patient, I would say, wouldn't you agree? It's directly related to your own experience and your son's experience.
Yeah, the passion is there because I went through it. I mean,
Yeah.
getting a home sleep test done for yourself. I use the sleep apnea team as a home sleep testing company, but there's so many out there. Getting yourself tested, getting a staff member, a family
Yeah.
member, a brother tested first through a very easy home sleep test, then being able to have that scored and given to you by a board certified sleep physician, then you can see the severity of the condition so easily. And then just doing a scan or an impression for an oral appliance if they're mild or moderate patients, which are 80% of patients that have sleep apnea,
Mhm.
and treating them with that. And just going, or yourself, and going through the process and seeing the benefits that most patients receive when they're getting treatment. It becomes kind of addicting to talk about it. And there's signs in the office. We always have patients that are walking in with sleep. They have anterior wear, they have scalloping of the tongue, they have acid reflux. Just a simple question.
What,
How do you
what about
sleep
the
at night?
patients? What about the patients who we go do a hygiene check? We come back and they're dead asleep, right? They're so
Yeah,
tired. We get
yeah.
so many of those. So I know that we're definitely gonna talk about what's the best way to connect with you near the end and whatnot. There's so many things we want to cover, but I feel like this is so important that I want to address it right now. So for those who are listening or those who are watching right now, they're like, okay, I understand how important it is. I like Dr. Radfar's story here. I'd like to see how this can be implemented in my practice. Like, how do they? We'll talk about how to reach out to you, but like, what are the first steps for someone who has no experience at all? They're listening. What you're saying is resonating with them. They want to do something. They want to implement this in a practice. What's the first steps when it comes to working with you?
Yeah, the first step is just learning what to look for and screening the patient. And that can come in a form from a questionnaire that I give to all my new patients.
Yeah.
My existing patients, I look at their medical history, some of the key things that come up that are comorbidities or correlated with sleep apnea as being one of the primary causes is high blood pressure,
Mm.
acid reflux, diabetes type 2, history of heart attack or stroke, or history of cancer. 5 times higher risk of cancer of any kind if you have the
Oh,
mild sleep apnea and you're not being treated for it. This is just the medical history. And then looking at the mouth, you learn what to look for, the signs of it. As I said, scalloping of the tongue, anterior wear, acid reflux, class 5 abrasions, all those things give us an opening of a conversation to, hey, Glenn, so, I've saw X, Y, and Z. We've noticed that this is associated with sleep apnea and snoring issues. How well do you sleep at night? Do you get quality sleep? And then you just let the patient, give you their story. And
yeah.
then I just offer the help. I tell them, would you be interested in getting a home sleep test? And I do the proper referral to the company that I use. And of course, I share that in my coaching and in my seminars. And then from that point on, when making the appliance, medical insurance reimbursement, and even if there is no medical insurance reimbursement, what's this worth to you all?
Yeah.
In an average appliance, the offices that I've taught, they charge about 2,500 an appliance, and that's life changing.
Yeah.
You have to remember, we have all these different types of products and services we offer, Invisalign, implants, and whatnot. When you have a sleep study diagnosed by a board certified sleep physician, explaining to a person through you that they have a condition known as sleep apnea, and they've already have medical comorbidities that are associated with it. And some of these patients already tried their CPAP and they couldn't tolerate it.
Yeah.
And now you're helping them breathing better, sleeping better, lowering their comorbidities. That's priceless. We have to kind of get away from the worry of selling
Yeah.
to really heart-centered treatment, which is helping them with a mouthpiece. And so that's kind of like how I go through the process. That's what I teach through Radfar seminars, is how to turnkey without buying any sort of equipment. You don't need home sleep testing equipment. You don't need really anything. Just open your mouth, open your heart, and share the knowledge that you have. And then you can start treating. And again, start with your own staff or your own family. It becomes very, very easy.
I love that. I love that. That is such a powerful message because I think so many times as dentists, we're looking at, well, is the patient, are they gonna pay for it? Like we get so wrapped up in that and we forget that this is something that I would want for myself. I would want for my family. I would move things around. I would do whatever it took if I knew it would make their quality of life better. And sometimes we just get scared. We're like, oh, we make the decision. We make the decision for the patient without even letting the patient make the decision. I love that message. I think that's something that everybody needs in the dental profession needs to understand. It's like it's an investment, right? People invest. You said $2,500. People invest like a couple of grand in a new phone, right? A new phone. They'll put like 3 or 4,000 for a new laptop. They'll pay God how much for a new car, right? Like a new Tesla coming out, right? They would pay all those things. But what is something that can affect their daily life, like every single day? It's sleep. It's sleep, right? So again, I love that. I love that. Okay, so we'll talk more about how to get connected there because I think this is super important. And I want you guys to focus on one thing, right? When you have purpose in what you do, you can do anything. You can treat anybody. You're passionate about it. You can hear from Dr. Radfar when he talks about sleep. You can hear the passion behind it. You can hear the story, man. I was like, I heard it a second time when you were talking about your family and when you guys immigrated, and of course now the story of just not falling asleep when you're leaving the country. That touched me there. When you guys have purpose there, you can literally treat anyone. Okay, so we're gonna shift gears here. We're gonna shift gears because you're an amazing entrepreneur, obviously, amazing practices, amazing coaching program, businesses, all these different things. So I'm not gonna let you get away. I'm not going to let you get away without sharing us some entrepreneur tips. We're doing the entrepreneur big three. There's going to be 3 entrepreneur questions I'm going to ask you. And the first thing is, what's a entrepreneur tip? I'll give you 2 options here. It could be a tip or a strategy, or it could be a tool you use that has helped you as an entrepreneur that you feel could help other people.
So one of the first things that I've always looked at is, since I've been a dentist for 21 years, is the more classes and courses I take and things that interest me earlier in my career, the more I'm adding to I call it sushi menu of services that I provide. For example, I graduated in 2002 in Los Angeles at USC, and right away in end of 2002, I took a course on how to do Invisalign. Yeah. And since then, I've done over 1,000 cases. If I started that later in my career, anything that interests you, I did traditional orthodontics through Progressive Ortho and a 2-year program. And now I've done braces for the last 15 years. If it interests you to do Botox for TMJ, sleep apnea, any other extra services that are kind of unique to providing better overall care, take courses. Learn how to do this 1, 2 courses that will add into your business more services that you can provide. And that's huge, including practice management courses. Mm-hmm. Like Glenn, communication is so important in our private lives. It's important for our leadership skills with our patients, with our staff. Learning how to just be a more effective communicator. There's tons of courses that you could take. So educate yourself, not only on the clinical aspect of adding more services that may interest you, including sleep, hopefully with me, but also in the way that you can express yourself to your patients, to your staff as a leader and as a provider.
Well, I think that's a great advice, timely advice, because the thing is that we always hear about people. They're like, I'm just kind of tired of dentistry. I'm just bored. I'm looking for other things to do. And the thing is if you're doing the same thing all the time, right? You're putting yourself you're putting a ceiling above your head. You're putting yourself at a limit there. When you're learning new things, it keeps things fresh, but also gives you an opportunity to grow your practice, right? By the more things you do. So I love that advice. I love also the advice you give as far as not just looking at the clinical, look at the business as well. I mean, dentistry is such a cool profession where we are a clinician and we can wear the business hat too, right? Like not too many health professions are like that anymore. And we're super lucky that dentistry is like that. Okay. So the next question, this one's a hard one. Okay. It's a hard one because if you're like me, I've made so many mistakes in my life. I don't even know which one to pick. But I'm going to ask you because, again, I truly believe that from the mistakes that you make and the mistakes that other people make, we can all learn from it, right? So that's why this part is really important. So share a mistake that you made that you learned something significant from that you could share with us, and hopefully we can learn something as well.
Definitely buying certain equipment, you have to be really cautious. I think spending, thousands of dollars on equipment that sounds good and is great, you got to be careful. That could be, taking up some room in the back and getting dust on it, and you're not using it as much. And that's a big investment that can go to waste. And that agony, that feeling of like the mistake that you made by buying this 50, 100, that is a horrible feeling. Right. So now when I buy equipment or anything that I want to use, I definitely speak to other dentists in my area that may have it. I even try to go shadow to that office and see, if it's something that I want to use in my own practice. I don't just rely on the rep that's in
Right.
the office that comes in, or the nice fancy bells and whistles that we see at the trade shows or the conferences. So that is the one thing that you want to make sure you don't go back $100,000 or so if you're wanting to buy a piece of equipment, that you want to make sure that it's something that you're comfortable in doing in your practice by shadowing other dentists and talking to as many testimonials as possible.
That is super important, guys. I think if you listen to that, Dr. Radfar just saved you a ton of money if you just listen to that. And I love the fact that you said, look at other people, not just listen to them saying, hey, this is a great product, but actually going and shadowing and watching them and seeing how they implement it. Hey, it might work for somebody, but if you look at it and you're like, I don't know, it doesn't work for you, you just saved yourself like a very expensive coat hanger. And we've all been there, right? We've all been there, guys like Dar and myself. We've been there. Learn from our mistakes. Okay, we're trying to tell you here. We're trying to, for all you young folk out there. But even if you've been practicing a while, this is something that you need to pay attention to. That's great advice. Okay, so I want to take you back in time again. Okay, we're gonna jump into our DeLorean, our hot tub time machine. We're just gonna go back in time. Okay, and Dar, if you can go back in time and find a particular point in time, and you run into the younger version of yourself. Okay, you only got 5 minutes. Okay, you don't have all day talking to. You have 5 minutes. You're gonna hold your younger self, and you're gonna give them some advice. What would you give them?
Man, I think, confidence is so important in the way you carry yourself. I would have probably, I was a very shy person up until I started lecturing in 2014 on sleep apnea. I mean, that whole purpose of me sharing what I've learned brought me out of my shell to be able to speak more and go up to people and share my story, as even volunteering my story, which before I was a little bit more shy to do so. So if I would go back to my young self, let's call it, when I was 25 and I graduated dental school, I would probably tell myself, take some Toastmasters courses or something that allowed me to be a little bit more, let's call it, extroverted and have better confidence in sharing my any sort of my thoughts and in a less egotistical way, and in a much more polite, respectful, understanding, engaging way. So I would enhance the communication skills. I think dentists, we're the one profession, it's so beautiful. We have the husband, the wife, the kid, the coworker. So for 10, 20, 30 plus years that are all coming to us, very unique profession. If you don't have the proper engagement of how to bond, how to connect, how to respect, how to be heart-centered, not just be super masculine in your thought process, but also to understand how to be compassionate and patient. This takes work. This takes experience with books and courses. So I would say definitely learn how to better communicate. That will help you not only in your private life, but definitely in your practice.
I love that. And, honestly, I think you're an amazing speaker. I think you're an amazing communicator. So when you told me that, I was shocked. I'm like, what? This guy is such a natural. He's so good. But this is such a testament of what you said, right? Like, not everyone, when you look at people who are speaking, when you look at entrepreneurs and all these great things, like, no one just comes out of the womb and gets everything. Right. This is like all the people who we look up to, all these amazing entrepreneurs, from like the Elon Musk of the world, the Jeff Bezos of the world. They're not like that. People forget that they had to work really hard to get where they went and fail. They failed a lot, and they had a lot of all the same insecurities that we have. The only difference is is that they just put their mind to it and they just did it, right? They didn't give up. So I'm so glad that you shared that, because honestly, if you didn't tell me, I would have never known. I think you're an amazing speaker. You're very easy to talk to. That would be the furthest thing in my mind, but that gives people the optics, right? Like, you guys, if you feel like maybe you have something to share and you feel like you're not a good speaker, well, you put in the work, right? You put in the work like everybody else, and you could, if you have a strong purpose like Dar does, that you can do it. So speaking of purpose, so before we tie things up, so for those who they're like, I want to go to one of your seminars, I want to possibly do some coaching, I want to learn more, I want to just connect with you and see where we can go. What's the best way to learn about your courses, to learn about your coaching, and of course to reach out to you?
Yeah, of course, you guys can all reach me through social media. Rad Health Inc. is my handle, or through radfarseminars.com. You can also see some of my products that I have, my sleep product that I have. I created the Rad Fresh, which is a spray bottle for sports guards, mouthpieces, Invisalign, retainers, all these fun things that I have on my social media, some of the fun videos that I created. And you could just DM me through Rad Health Inc. Instagram. Dar Radfar at gmail.com is my email, if that's easier for you all. And I'd love to communicate and guide you in any shape or way I can make you successful. I'm all about paying it forward. If I can help one of you, help one patient, we can hopefully reduce any sort of car crashes out there. 4% car crashes are people falling asleep at the wheel. If I crashed not into a tree and into a family, my life would have been over. And I see consistently patients who have had this into my office, have had these horrific incidences, both physically, emotionally, relationship-wise. It's such a game changer. And if I can help one of you treat your patients in any way I can, that's a reward in itself to paying it forward.
Wow. I don't know what else to say after that, man. I'll let you have the last word there. But guys, reach out. We'll put that in the show notes as well. And of course, Dar's, he's pretty active on social media. Shoot him a DM. I mean, that's how I got to get to know him, right? I shot him some DMs. So do the same thing. He's always available. Dar, thank you so much for jumping on. Guys, thanks for tuning in. See you guys next time.
Thanks, guys.